Thank you. As Sal mentioned earlier, Lee Health is focused on wellness, and the work that we do cannot be done by ourselves. We cannot be an individual doctor and create wellness in our community. It has to be in a system, and Lee Health supports us. We are lucky to be in a system that supports a wellness approach. We are lucky to be in a system that allows us to present wellness to the public and allows us to have a great team. In order for me to function the way I do in my clinic, I have a great team. I have dietitians, we have amazing therapists, we have amazing nurses, and it's a whole team approach. So I want to thank Lee Health again for allowing us to do that. So I'm going to talk about a patient first, Mistypical. This is a patient I see very frequently. Being in a spine center, I see this patient probably every day, and probably many of you know this patient, or a patient just like this. So this is a 60-year-old female with back pain. It's been there for about 6 months. She remembers lifting something, may or may not, heard a pop, and then is having a lot of back pain since then. She came into my clinic. We did some physical exams. She has tenderness, and we did an x-ray, and she had a little compression fracture in her lumbar spine. This was a chronic fracture, so we weren't able to do any surgery or anything like that, so we decided to do a conservative treatment for her. She also has osteoporosis, has a sedentary lifestyle, standard American diet, or also known as the SAD diet, has GERD or acid reflux, and she's on medication, also has depression, anxiety, also more medication, and high cholesterol, and is on Lipitor. So who knows Mistypical? Who's heard of Mistypical? Who's seen her in your clinic? Or who's, knows a neighbor? So as Sal said, I'm a little atypical, so I try to do a lifestyle approach to treatment. And lifestyle as medicine prescription is what I prescribe. So I would prescribe physical therapy, daily walking outside. I would ask my patients to really go out there, get their heart rate going. Core food plan is what we use. We have many different food plans in our clinic from the Functional Institute or from the Institute of Functional Medicine. The core food plan is a typical kind of starting plan. We have patients start off with lots of vegetables, some lean proteins. It's like a Mediterranean diet. I ask my patients to cook bone broth. Who likes to make bone broth? My wife created bone broth for me last week. She cooked it for 72 hours this time around. So 72 hours cooking bone broth. And why would I do that, right? I ask my patients to do morning green smoothies, taper off the Magnesium eventually as the diet improves, as the acid reflux improves. We ask them to do some meditation or prayer at the same time. And then as things get better, possibly consider getting off Zoloft. So the patient came to me with a compression fracture, with back pain, and why am I doing all of this, right? Why am I asking her to make all these lifestyle changes? So today I'm going to talk about a little bit about the science behind why all these lifestyle changes work. And they do work. We see this. When patients engage in this lifestyle change, their life changes, their pain changes, and their skeletal health changes. So let's talk about the skeletal system first. What is the skeletal system? It's our framework. It's what holds me up today. I'm able to stand up here, which allows you to sit and be alive. It's also a place where we store and release minerals, so all our calcium, magnesium, potassium, all these things that we need interchange in our blood vessels and in our body are stored in our skeletal system, and also produces blood cells and stores energy. So what I want to show you is that everything is connected. I am not a bone doctor. I am not a gut doctor or a brain doctor. I am a doctor of everything, right? We want to make sure that everything is connected. The bones, the gut, the vascular system, the brain are all connected. So we can't just treat the bones. We can't just treat the gut. We have to treat the whole person. And obviously in the middle is the food plate. We got to treat it with good food as well. So let's talk about bones. Bones are made of collagen. Type 1 collagen is the type of collagen found in bones. There's many different types of collagen in our body. Type 2 is in our cartilage, and we have about 28 different types of collagen. Type 1 collagen is the most prominent. We have about 90% of our collagen is type 1 in our body. It's also in our ligaments. It's in our skin. Bones also have minerals, which are in the ground substance, and water, and then cells. There are some cells doing constant work in the bones. So we're going to kind of break this down, and we're going to look at how food and lifestyle can affect each part of these, or each one of these parts within the bones. And then we'll talk about strength and fragility. We want strong bones, right? That's why the patient came to me. She wants to see how she can make her bones stronger. And people with osteoporosis have fragile bones. So how does your lifestyle affect either strength or fragility of your bones? So collagen gives our bones the tensile strength. As you can see in this picture, it's like the lattice work. It's where all the other cement is going to be laid on. It's the foundation of the bone. And if we don't have good collagen, the bones, you can have all the calcium you want, but if the collagen's not there, the bones are going to be brittle. They might be very hard, but they're not going to be strong. And that's what collagen gives us, the strength. Like as I mentioned before, collagen type 1 is the type of collagen we have. It's about 28% of bone. So quite a bit of bone is made of collagen. The amino acids that make collagen are proline, glycine, alanine. Those are the main amino acids that are found. And then hydroxyproline is another very important amino acid. Collagen is these fibers that are wound up in a triple helix. And they're basically wound up really tightly. And what keeps them together is this hydroxyproline amino acid. We'll talk about a little bit later how important that is. It's actually, to make hydroxyproline, we need vitamin C, and we'll talk about that. But that's what keeps that collagen all nicely wound up, and that's what gives you that bone strength. So why do I prescribe bone broth? And why does my wife cook 72-hour bone broth at home, right? Well, bone broth has all the amino acids that we need for collagen, right? It has the proline, has the lysine, has the glutamine, and actually it has also glycans, which are found in the cartilage of our joints. So you get the chondroitin, glucosamine, hyaluronic acid. Who's heard of glucosamine chondroitin for joint health, right? Well, if you drink bone broth, you will get your glucosamine chondroitin, right? And some other things. And it was interesting, when you drink the bone broth, peak plasma concentration happens in about 1 to 2 hours. So scientists measured your blood after you drink bone broth, and within 2 hours, those amino acids are found in your blood. And they're there spreading in your bones and in your collagen. The reason I like bone broth is it has a lot of glutamine. And Teresa might touch up on that, but glutamine is involved in feeding the cells of the gut. And the gut cells, they want to be fed something that they can keep them healthy. And glutamine that is found in bone broth is the perfect food for them. They crave it. So when you drink bone broth, you actually heal your gut. You heal leaky gut syndrome, which Jose might talk a little bit more about. So collagen has actually been shown to help weak bones. It increases bone strength and bone mineral density. And I'm talking about dietary collagen or gelatin. You know, everybody has had gelatin. Gelatin is made from collagen. And it decreases bone loss in women with osteopenia. So again, women with osteopenia, let's drink bone broths. Let's eat the chicken feet in this picture. Our chicken feet. Who eats chicken feet, or who has eaten chicken feet? I know my wife is going to raise her hand because we love to go out to Chinese restaurants and eat those little tiny things. Well, it's got a lot of collagen. It's got all the amino acids that we need for bone health, right, and our gut. So you can cook them, you can eat them, whatever you want to do with them. Just eat them. So that's the collagen component. Now the minerals, that's what gives our bones the hardness, right? That's the ground substance. And most of it is made from calcium and phosphate. You put those together and it makes hydroxyapatite. That's about 50% of our bone. And then you have the trace minerals and some water. And I like to compare it to the concrete, right? We have the lattice, or we have the foundation with the metal bars, and then you start pouring the concrete. That's going to be our ground substance, all those minerals. And just like concrete, you need appropriate amounts of sand, gravel, cement, and water. If you put too much calcium or too much cement, things don't go right, okay? And we've tried it, and I'll show you that. When we put too much calcium in our bones synthetically, it doesn't necessarily do as well. So calcium and bone health, got milk, right? We have hundreds and hundreds of commercials with people with their little milk stains and got milk. And is that the answer? Is that the answer to bone health? And we'll take a look at it. It's kind of conflicting. As I was preparing for this lecture, this was my biggest struggle, is the milk and calcium conflict. So we'll look at it. So go milk, right? Dietary calcium intake in children is associated with bone mineral density. So children, some studies looked at that children that drink more milk might have stronger bones. Women with low milk intake during childhood and adolescence have less bone mass in the adulthood, and it may have an increased risk. And this was published in 2003 at the Journal of Clinical Nutrition. So that's a pretty good journal. It sounds pretty viable. And then frequent milk consumption before age 25 influences hip bone mass in middle-aged women. And again, this was published in 1994. So there's some pretty good science that says that, hey, milk might be not bad for us, right? But no, maybe were we wrong, actually. So later on, in a meta-analysis published in the Journal of Bone and Mineral Research in 2011, found that there was no association with milk intake and hip fractures, even at high milk intakes. So the data is not really solid. It's kind of conflicting. Milk consumption during teenage years was not associated with lower risk of hip fractures in older adults. Instead, there was a significant 9% increase observed in men for risk of hip fractures. So it's kind of conflicting. And this is more recent data. This is data from 2014. Again, large meta-analysis. So I'm not really sure. Should I tell my son to drink lots of milk for strong bones? I say, let's eat greens, okay? Let's eat greens, green vegetables, right? Let's eat greens, veggie fast. As you can see, collard greens, spinach, turnip greens, mustard greens, some of the best foods for calcium, right? So that's pretty safe. Nobody ever told us that green vegetables are actually going to hurt our bones. And I'll show you some research behind how they do help. So let's have our kids eat the greens for the calcium that we need. Actually, vegetables, higher intake of fruits and vegetables has been shown to affect mineral bone density in both younger and older women. And for me, in the spine especially, right, in the spine center. So I tell my patients, eat vegetables, eat fruits. And I do that very comfortably because I know the science backs it up. And I don't tell them, go ahead and start drinking milk because I'm not very comfortable with that at this point. Here's another study looking at some Chinese women in different age groups, and they looked at their fruit and vegetable intake. And again, the more fruits and vegetables, that's the black bar, the more fruits and vegetables they ate, the higher their bone mineral density. Again, very good data here. I feel very comfortable prescribing fruits and vegetables. So what about calcium supplements? Who's heard of people taking calcium supplements? You got weak bones, let's put you on calcium supplements, right? I don't think so, actually. There's some data that shows that they're not so good. Just like in that concrete, putting more gravel, more sand, is that going to make it stronger? Probably not. So calcium supplements have not been shown to significantly change bone mineral density. Calcium supplements did not show to decrease fractures. No. And meta-analysis of calcium supplements suggests actually an increased risk of fractures. And there's a really good multiple meta-analysis in the cardiology journals that look at calcium supplements increasing your risk of heart attack. So when I see patients on calcium supplements, I always question it. I'm talking to them, are you sure we want to do that? Let's eat greens instead, right? Too much gravel, right? Too much gravel will not make that concrete stronger. We need the right proportions of the gravel, of the sand, of the cement, of the water. So phosphorus is the other component of that hydroxyapatite, and that comes from protein foods. It's rich in protein foods, and women that have been looked at that have actually protein deficiencies don't have enough phosphorus, and it increases their bone fragility. So we need some of those proteins and the phosphorus found within them. It's the sand in our concrete. And where do we get phosphorus? It's found in foods like scallions, cod, so fish, mushrooms, pumpkin seeds, lentils. I recently started prescribing more mushrooms in my clinic. Mushrooms are amazing. They give us all these nutrients, but actually mushrooms have been shown to increase nerve growth factor. And there's multiple studies. I like the one, lion's mane is the one that's been mostly studied. So it increases your bone or your nerves to grow. So when we're treating nerve damage, I prescribe mushrooms. So does protein adversely affect our bone? There's some studies that looked at, hey, too much protein makes your blood a little bit acidic, and then your blood has more calcium in it and urinate more calcium. So the thought was, hey, this calcium is probably coming from our bones, and you're peeing out your bones. But further studies later on found that actually it wasn't coming from the bones. When you eat more protein from meats or vegetables or lentils, that the protein is actually coming from the gut. You're absorbing more protein. Your body's smart enough. It says, hey, my blood is going to be a little bit acidic. I need to neutralize it with some calcium. Let's absorb more calcium. So you're absorbing more calcium. You neutralize it. You urinate more. It may affect your kidneys. So too much protein I don't think is good. Too much animal protein. But just enough. I like to walk the middle path. I am not a vegetarian, nor am I a Atkins follower or a Paleolithic follower. I like to walk the middle path. I like a little bit of this, a little bit of that. Just kind of stay right in the middle. And I like a nice array of food. And this is our core food plan that we use in our clinic. It's the Mediterranean diet. We eat a little bit of protein, lots of greens, lots of vegetables, maybe a little bit of wine. I'm sure Jose will like that as well. And JERF, I like this. Jose presented this last year. JERF, just eat real food. Mostly vegetables, mostly greens, not too much. That's what Michael Pollan talks about in his book. So what about vitamin D? Does vitamin D affect our bone health, right? We constantly hear about vitamin D. Vitamin D actually helps our body to absorb the calcium and the phosphorus and helps to stabilize the calcium and phosphorus in our bones and in our blood vessels. And also has a nice regulatory effect on some of the cells, on the osteoblasts and osteoclasts. We'll talk about them a little bit more. But it helps nice functioning of these cells that help to keep our bones strong. Deficiencies in vitamin D, it can actually create an abnormal turnover in our bones, and it can actually create weak bones, osteomalacia, where these bones don't get mineralized very well, and they are fragile and they fracture easily. So low levels of vitamin D are common in osteoporotic patients, unfortunately. And this is the one place where actually supplementation of vitamin D has been shown to be beneficial in preventing fractures, preventing bone mineral density, supplementing, or let's say getting enough vitamin D. And if you can't get enough, we use, we'll take questions at the end. Can you hear me, or? A little bit more slowly, sorry. Am I speaking too fast? I'm sorry, I got a lot of information and Sal told me I have to be within 45 minutes, otherwise he's going to bring out the whip. So I'll try to slow down just a little bit. Thank you for that comment. So where do we get our vitamin D? About 10 to 15% of our vitamin D comes from food. And the foods that give us vitamin D are the fatty fish, eggs, mushrooms, some meats, and sometimes dairy products that are fortified. We have to fortify our products now with vitamin D because we know that nobody's getting, or most people are not getting enough. And believe it or not, in Florida, we have vitamin D deficiency, right? We're in a sunshine state. You'd think everyone has plenty of vitamin D. Well, no, I check vitamin D regularly, and our patients are low. We're using so much sunblock. We're actually constantly, we're deficient here. So about 90% of our vitamin D comes from sunshine, and I do prescribe sunshine therapy. I prescribe it to myself as well. During lunch, or before lunch, between patients, I go out, and I tell my nurses, I'm going for sunshine therapy. I'm going to take some, I take a little walk, I get some exercise going, I do a mindful walking meditation, and I get some sunshine, right? So you can actually get 10,000 units of vitamin D from full body exposure for about 15 to 20 minutes outdoors, okay? So that's more than most of our supplements, right? How many people take vitamin D supplements? You usually take, 1,000 units, 2,000, maybe 4,000 units. If you go out and lay naked in the sun, you will get 10,000 units. Try it. So the other thing our bones need is water, right? We need water, just like in that concrete. We need the fluidity. So I do tell my patients, make sure you're drinking enough water. You need it for the resilience. We need the bone to be nice and moist at the same time. So dehydration of bone can actually make it harder, but less, or stiffer, but less resilient to fractures. So we got to make sure we have enough water in our systems. So we talked about the minerals, the collagen. Now we got to talk about the working crew, right? The cells of our bones. That's the osteoblasts, which are bone builders, and osteoclasts, the cutters, the demolition crew. So the osteoblasts synthesize the dense collagen, right? We talked about how we need the collagen. They form the mineral matrix, the calcium and phosphorus together, and they secrete stimulating hormones such as osteocalcin, which is a vitamin K-dependent process. We'll talk about a little bit more vitamin K, which comes from greens again, right? So these are our builders. And then we have our osteoclasts. These are the bone destructors. Those are the ones that kind of break down the bone, and they secrete collagen enzymes, and they secrete free radicals. Who's heard of free radicals in the past? So they actually secrete free radicals to break down bone. And we need both of them. We can't just say, we just need builders. Otherwise, we'd be just bone and bone, right? We need a nice array of osteoclasts and osteoblasts constantly working through that bone. So there's a never-ending construction in our bones, right? These guys are constantly remodeling, removing old bone, damaged bone, and replacing it with good bone. And they do that where the bones have the appropriate load placed on them. So let's say you eat all the right foods, and you have your osteoclasts and osteoblasts doing their thing, But you just sit around and do nothing, and there's no pressure placed on those bones are not going to be strong because these cells actually need that pressure from the outside to stimulate them and to tell them, hey, which way should I lay these collagen fibers? So you got to put the appropriate loads. So let's talk about oxidative stress. I gave a whole lecture on oxidative stress last year. Today I'm just going to give you 1 or 2 slides on it. So oxidative stress is when there's a lot of free radicals in our body. And free radicals we get from diet, from stressing out, from smoking. And basically our body tries to neutralize these free radicals with antioxidants. But when we don't have enough antioxidants from our foods, from greens, then there's what we call oxidative stress. And production of free radicals is necessary. We need it. The osteoclasts need it to break down the old bones. We need it when we have an infection. So let's say some bugs enter our system. We need those free radicals to be sprayed on them and kill them. But again, we got to have them in balance. So we don't want to be in oxidative stress. We want to have an oxidative balance. So as I said, osteoclasts produce the free radicals to break down this old bone. And they resorb, kind of melt away the bone. And then more free radicals actually stimulate more osteoclasts. So it's kind of like this loop that, they produce free radicals and then they stimulate themselves even more. So increased free radical levels have been shown to be negatively affecting bone remodeling and actually bone healing. So people that have too much oxidative stress and they fracture their bones, they will not be able to heal very well because these osteoclasts are just working really hard. So oxidative stress and bone health. Women with osteoporosis have actually been shown to have increased oxidative stress. They have less total antioxidants and have more total oxidatives, oxidants, I guess we were going to call them. There's a pretty nice, clear correlation between the level of oxidative stress and the bone mineral density. So the more oxidative stress, the lower the bone mineral density. And smokers who have a lot of oxidative stress, if you want to have oxidative stress in your body, smoke. That's probably the best way to damage everything in your body. So in smokers, there's a lot of oxidative stress, and in these people that don't get enough the fruits and vegetables to neutralize that, their bone mineral density is low as well. So what else can we do to increase our oxidative stress? Go to McDonald's, get yourself a Happy Meal or a nice breakfast, and wham, are you going to get some oxidative stress. There's some good studies looking at your blood levels after a McDonald's meal, and the oxidative stress index goes up significantly. Iron inflammation goes up significantly. So then they took these patients and they fed them some blueberries. And guess what? The blueberries actually protected them. So I'm not saying go ahead and eat a bunch of blueberries and go to McDonald's, just eat the blueberries instead. Blueberries actually decrease oxidative stress. So antioxidants can help bone health. Blueberries have been studied in rats. Unfortunately, we weren't able to study it in humans, but in rats they help with decreasing bone loss. And then also omega-3 fatty acids. Who knows what omega-3 fatty acids are? That's found in fish oil, flaxseed oils. Those are very antioxidant, very potent anti-inflammatory chemicals, and they actually decrease inflammation and they help bone health as well. They can help your bones, and they decrease the resorption of the bone from the osteoclasts. So where do we get our antioxidants? Blueberries. Right? That's probably my favorite antioxidant food, and it's the wild blueberries. So when you go to Costco and you're picking your blueberries, pick the little tiny ones, the little wild frozen blueberries. My wife always comes home every couple of weeks with these huge bags of frozen blueberries. We just keep them in the freezer. Freezing blueberries will not change their antioxidant level. So that's fine. Cooking them, on the other hand, well, but we're not going to cook blueberries, but freezing them is fine. And so we keep bags of frozen berries because those are probably the highest, they are the highest antioxidant foods. Raspberries, prunes, artichokes, a lot of good stuff. But I usually tell my patients, if we're going to, if we ask them to do that green smoothie, right? Remember I asked my patients to do a green smoothie? Put blueberries in them. So let's talk about vitamin C. Vitamin C we know is an antioxidant, so already it would help with oxidative stress as well. But it is needed for that hydrolyzation of that proline and lysine. And remember, I mentioned earlier, when we make that collagen fiber, which is a triple helix fiber, what holds them together is the hydroxyproline. And how do we get hydroxyproline? It's a vitamin C dependent process. So we need vitamin C to make that hydroxyproline. So people that don't have enough vitamin C are not able to make enough collagen, and those bones become weak and fragile. Vitamin C has been shown to help also with stimulation of the osteoblasts, the bone builders as well, and decrease the production and activation of the osteoclasts. So it kind of makes our body be more into bone building mode. And we live in a land of excess. So Paul Pitchford, in his book Treating Healing with Whole Foods, he's a Chinese medicine doctor, talks about the deficiency in the land of excess. We are in a land of excess. We have excess of everything, and especially, calories and sugars, but we are still deficient. A good study looking in 2003 and 2004 looked at 7,000 people and found that 7% of people are deficient in vitamin C. Okay? And another study looked at 500 people. 6% people were vitamin D deficient, and 30% of these people were actually vitamin C depleted. So they're not deficient, but they still don't have enough vitamin C. Symptoms of vitamin C deficiencies: fatigue, swollen joints, muscle pains, bone aches, right? Their collagen fibers are not pretty good, bleeding, and emotional changes. And vitamin C and ascorbic acid is not the same, right? Where do we get our vitamin C? Vitamin C is found in our foods, in our fruits and vegetables: papayas, bell peppers, broccoli, pineapples, oranges. So usually when I prescribe the shake, I tell my patients put an orange in there. At home, when I make my shake for my wife and my son and myself, I put an orange with my greens and my berries. Lots of good vitamin C. See, ascorbic acid, which is the supplement, is different. So if you look at a whole vitamin C molecule, and you take a little pie of it, maybe like 30% pie, that's ascorbic acid. Okay? But then you're missing the whole 70% of the vitamin C molecule. So to really get vitamin C, we got to get it from our foods. Ascorbic acid is not the same. So what about vitamin K? What is vitamin K? It's made by plants. It's most abundant in the green leafy vegetables, directly involved in photosynthesis. And its vitamin K name comes from coagulationsvitamin, from the German word, and is known for blood clotting. Who's heard of vitamin K? Who knows people on Coumadin, right? When you're on Coumadin, you can't eat vitamin K-rich foods because it's going to interact with the Coumadin, unfortunately. Or you have to eat a steady level and then find the right amount of Coumadin. So vitamin K is needed for production of osteocalcin. Remember I talked to you guys earlier about osteocalcin is made by osteoblasts, and it stimulates the osteoblasts. It stimulates the production of bone, and this is a vitamin K-dependent process. And osteocalcin promotes bone formation, it stimulates bone mineralization and actual making of that matrix. So who is vitamin K deficient? Well, plants make vitamin K1, and then vitamin K1 is converted to vitamin K2 by our gut bacteria, the pancreas, and arterial walls. So diets low in vitamin K obviously cause vitamin K deficiency, but also people who have been on broad-spectrum antibiotics, people who wiped out their good bacteria are not able to convert that good vitamin K. And Teresa is going to talk a little bit more about the gut bacteria and how important it is in health. People with chronic kidney disease have low vitamin D. People on Coumadin are always, unfortunately, vitamin K deficiency. And studies looking at Coumadin and osteoporosis show there's a link. People on long-term Coumadin have an increased bone loss and increased osteoporosis. It's unfortunate. And unfortunately, elderly people do produce less vitamin K too. So increased intake of vitamin K has been shown to decrease bone loss and reduce fracture risk in postmenopausal women. So again, go greens, right? Go ahead, Veggie Fest, or however you want to get your greens. Low vitamin K is associated with increased fracture risk and osteopenia. So where do we get our vitamin K? Kale. Kale is one of my favorite vegetables. I prescribe kale on a daily basis. Some of my partners prescribe OxyContin and oxycodone. I prescribe kale. It's much easier on the system. Spinach, mustard greens, collard greens, beetroots, Swiss chard, all these greens are high in vitamin K. So let's load up on them. So this is a very common prescription in my clinic. Green smoothie. Put some kale, put some berries, put some orange, maybe put a little bit of sprinkle of turmeric, some ginger, maybe some omega-3 fatty acids from flax seeds, and there's your prescription. So if you come to my clinic and I prescribe a smoothie, you know why I'm doing it. I'm not crazy. It is part of my healing treatment. So magnesium and skeletal health. Magnesium helps to move the calcium from the soft tissue and blood into our bones. It stimulates osteoblasts and inhibits osteoclasts. Again, more bone building, less bone breaking. And more than 50% of people are actually vitamin C deficient. It's ridiculous. I'm not sorry, Magnesium deficient. Magnesium deficiency is associated with impaired bone growth, skeletal fragility, and osteopenia. In this study, looking at men and women and their magnesium and potassium intake, showed that people that take in more magnesium and potassium-rich foods have higher bone mineral density, both in men and women. And where do we get magnesium? We get it from our foods. Again, we get it from spinach, another wonderful green, Swiss chard, pumpkin seeds, sesame seeds, black beans. Again, food. So make a nice little stew of all of those, and there goes your magnesium, potassium, vitamin K, everything else you need. Zinc is another very important mineral when it comes to bone health. It's an essential mineral that acts as a cofactor in 200 enzymatic reactions in our body. It's needed by the fibroblasts to produce collagen. It's needed for proper calcium absorption. It's needed for bone healing. And zinc deficiency in children has been shown to decrease growth and cause growth retardation. Zinc status is actually lower in people with osteoporosis. It correlates with their bone mineral density. So again, the lower your zinc status, very often lower bone mineral density. And in patients with thalassemia, which have naturally low zinc levels, zinc supplementation has actually been shown to improve their bone mineral density after 18 months in the study. Zinc has also been shown to help with fracture healing. There's a nice double-blind placebo-controlled trial looking at people taking zinc supplements, unfortunately, not foods, because you can't double-blind foods, unfortunately. So put it in a pill and you can double-blind it. So 60 patients were taking either zinc or placebo, and we were looking at their fracture healing. And people with the zinc, increased zinc content, would actually heal their fractures quicker. The callus on the fracture would form quicker and was stronger. So where we get zinc, besides pills, we don't want to get pills, we get it from food. Beef, I do like beef, so I don't tell my patients that, not everybody has to be vegetarian. You can if you want to, it's an option, but you can get it from spinach. Go spinach again, right? Asparagus, mushrooms, another good sell for mushrooms, another reason I prescribe mushrooms. Lamb, different seeds. So as you can see the pattern. The greens, the mushrooms, the seeds, some good meats. These are all things that we need as our nutrients. So we need the good stuff, right? Let's get some good stuff. Get rid of the bad stuff. Get rid of the McDonald's meals. Get rid of the cigarettes. Let's put in some good stuff. So how do we get this good stuff in, right? Well, we know that we need good stuff. I showed you what the good stuff is, and I showed you what the good stuff does to your bones. Now, how do we get it in, right? We have to eat it. And not only that, but we have to have a healthy gut. So the gut and skeletal health, the gut is needed to bring in these nutrients. So Hippocrates said, all disease, and health begins in the gut. And I tell this to my patients. I'm a spine doctor. I'm a pain and spine doctor. Yet most of my patients who can tell you, we treat the gut. They come in and we're talking about bone health, and then I ask them, oh, how's your poop? Are you having a bowel movement every day? And I'm treating their gut. Why am I doing that? Because health and disease starts in the gut. And Teresa is going to tell us a little bit more about that. So the stomach is like that pot. In Chinese medicine, the stomach is considered a 100-degree pot, and it cooks all the food. It needs the acids, it needs all the processing. It makes that nice soup, right? And that's why sometimes people that have a hard time with digestion, we ask them to make bone broth and soups, because it's a lot easier. Even though you take a beautiful vegetable or some food stuff, and who has, let's say, 100 units of a nutrient, let's say 100 units of vitamin C, you cook it, you lose maybe 20% of it, but that's still okay because the cooked food is much easier for us to assimilate. We don't have to cook it in our stomach anymore. So even though it might be just a little bit lower on the nutrient value after you cook it, still warm soups, warm foods are easier for us to digest, especially the older we get. Older people and elderly really need that warm cooked food more than some of those raw foods. So we need stomach acid, right? We constantly hear about stomach acid being bad. Too much stomach acid. Well, no, we actually need stomach acid. Our stomach is made to have acid. It loves acid. It's produced by parietal cells, and it breaks down the proteins and the amino acids, kills the bacteria. People that don't have enough stomach acid have increased risk of infections, right? Because that stomach acid is needed. A low stomach acid, which is also known as hypochlorhydria, can lead to nutritional deficiencies, like you're not absorbing minerals, magnesium, zinc, vitamin C, vitamin K, and B vitamins. We just talked about those, right? We need them for our bone health, but if you don't have enough stomach acid, you will not be able to absorb them. So how do we get stomach acid? We need to rest and digest. There's a first phase of digestion. It's called a cephalic phase. It's a fancy word for it's your brain phase. So you sit down, you look at the food, you smell it, and your body stimulates all these beautiful juices. About 30% of your hydrochloric acid is produced before you even take the first bite. It's the smell, it's the thought about the food. If I think about my wife's cooking, I can already salivate and my stomach acids are going, okay? So rest and digest versus look at the other guy. Is he rest and digest? You think he's producing stomach acid? He's putting orange juice in his cereal, okay? That's acid, yes, but he's not producing stomach acid. Rest and digest. So proton pump inhibitors, who knows of proton pump inhibitors? PPIs, Nexium, Omeprazole, Protonix. Who knows somebody on Protonix? I feel like 60% of my patients come in there they have acid reflux and their Protonix or Nexium. It decreases absorption of the vitamins, and in multiple studies it has been shown to decrease bone mineral density. It increases risk of osteoporosis and fractures, right? So you have stomach acid, let's go ahead and kill it with some proton pump inhibitors. I don't think so. These medications have some serious side effects. Sal gave a whole lecture last year about all the other side effects. So we need to be very careful with that. So how do we treat acid reflux? A lifestyle approach, right? We don't do that. We don't eat burgers while driving in a car and stressing and rushing to work. We also ask our patients to find triggers. We usually have them go to see our dietitian, Julie Hill, and we have them find, do like an elimination diet, find some triggers. Very common ones are glutens, sugars, sometimes coffee. So I have patients that come in. I drink a pot of coffee every day. I have acid reflux. My doctor put me on Protonix. Duh. Right? Well, first we try to eliminate the coffee. Does it improve? Many times it does. Okay, so and sometimes we use some calming herbs like chamomile, peppermint, just to calm the stomach if it's still too irritated. So the absorption, we talked about the digestion. Does absorption affect your skeletal health? And gastrointestinal diseases that have an absorption issue, and digestion and absorption are linked to osteoporosis. So bone mineral density is decreased and fracture risk is increased in patients with gastrointestinal disease with malabsorption and maldigestion, disease like celiac disease or post-gastrectomy. People that had a gastric bypass, they have an increased risk of osteoporosis because they're not absorbing, they're not digesting. Inflammatory bowel disease, Crohn's disease. I treat a lot of inflammatory bowel disease in my clinic. Why do I do so? Not because I'm a gastroenterologist, because I'm a doctor looking at the whole person, right? All right. So we know the good stuff, right? We know all the good stuff that we need to eat. We know that we need to digest it. We need the stomach acid. Now, how do we get this good stuff to our bones, right? How do we get it there? We need the blood vessels to bring it there. We need our good circulation. So let's look about atherosclerosis. Atherosclerosis is hardening of our blood vessels. It's calcification of our blood vessels. It usually comes from oxidative stress. It's, again, from the McDonald's meals, from smoking. And there are some really good studies looked at McDonald's meals and the relaxation and constriction of your blood vessels. So Dr. Vogel is the one that did all these really cool studies. He had some patients go to McDonald's, eat some meals, and then he checked how their blood vessels relaxed. And they wouldn't. For about an hour or two, those blood vessels were in a shock, okay? They did not want to relax. So do you think their circulation was good during that time? No. So what do I say? Eat some blueberries. So how does that circulation affect our bones? There's a pretty good association with aortic calcification. So that's that blood vessel right here, the main one that goes to your hips and your legs. There's a good association between calcification of the aorta and bone mineral density of the hips, positively associated with osteoporotic fractures. So the progression of this calcification is pretty linearly associated with decrease of bone mineral density. So the more you have calcification in your blood vessels, the less of the good stuff gets to your bones, and the more bone loss you have. Obviously, I have to throw in a pitch for spine center too. So aortic calcifications also affect spine health. We see patients that have horrible disc disease and degenerative bone disease in their spine. aortic calcification plays a role in that. So the more calcified your arteries are, the less blood flow goes to those discs, and the less those discs are resilient to movement, and the more injury they get. So how do we treat them? Greens 3 times a day. So Dr. Still did these wonderful studies and showed how we can actually reverse aortic, well, not aortic, but calcification in our blood vessels through he does a pure vegetarian diet, but he talks about eating greens every day. So I challenged myself. I'm like, can I eat greens 3 times a day? So I did. Here's my breakfast, lunch, and dinner. These are pictures of my food. And yes, it can be done. Greens 3 times a day. So now what else do we need? We need blood vessels to be pumping pretty well, and we do that through exercise, right? Aerobic exercise, weight-bearing exercise, resistance exercise, all are effective in increasing bone mineral density of the spine, right? The spine and hips in postmenopausal women. This is a really cool study looking at 60 patients, postmenopausal women. 30 of them exercised, 30 of them didn't. And they did outdoor walking for 1 hour every day. 4 days a week at 50% of their maximum. I like one thing that we need to pay attention to is outdoor walking, right? They're not walking inside. So what else do you think they're getting when they're outdoors? Sunshine vitamin, right? So these women had decreased urinary cross-linked and terminal telepeptides of collagen type 1. What does that mean? It means basically they had less breakdown of their collagen. They had less breakdown of their bone. They measured their urinary NTX, we'll call it, and they were not breaking down bones. Their walking actually improved their bone. And they had increased bone mineral density, 6 months and 12 months. Exercise does that. And I prescribe exercise every day to my patients. So what about mind health, right? Does that affect our bones? And we know it affects our whole health, and Jose is going to talk a little bit more about that. You know, depressed people are more sedentary. They have less exercise. They are more indoors, so they don't get vitamins, sunshine vitamin. They have usually poor diet, increased inflammation. So when people are depressed, anxious, stressed out, scientists actually look at these patients and measure their inflammation levels and their antioxidants, and it increases your inflammation. It increases your oxidative stress. Relaxation actually does the opposite. And medications, people are often on medications for depressions and anxiety. Who knows of people on medications for depression and anxiety? We all do, right? Does that affect our bones? Yes, it does. So anxiety and depression medication can have a negative effect on our bones. SSRIs, which are the most commonly prescribed antidepressants, like Prozac, Zoloft, Lexapro, and TCAs, like amitriptyline and midodrine, actually have been linked to reduced bone mass and increased risk of osteoporosis. It's related to the 5-HTTP receptor on the osteoblasts and osteoclasts. They actually alter the way these cells are working and increase our risk of osteoporosis. So again, some patients that I have, I ask them, let's see, can we work on your depression otherwise and slowly get you off of these medications? Mindfulness meditation. Who's heard of mindfulness meditation in the past? Okay, if you're in my clinic, you probably have. If you're in Jose's clinic, you have. Jose gives a beautiful lecture on mindfulness. Jose is also teaching mindfulness at Coconut Point. So if anyone is interested in learning mindfulness meditation, Dr. Jose Colon will be teaching that, and maybe he can tell us a little bit more about it. We use apps because everybody has a smartphone. Who has a smartphone? Everyone does, right? Everyone in my clinic does. So we use these apps on our smartphones that help you with mindfulness meditation, calm or stop, breathe, and think. And I have my patients put on their little earbuds at home and have a guided meditation, which helps with stress and anxiety. And there's lots of research behind it. So we can manage that and hopefully get you off some medications that will help your bone health. So hopefully through this talk, I hope you've learned why I do what I do, right? And is there science behind what I do? I've been told by other practitioners sometimes, oh, Dr. Sebastian, he's an osteopath, he does some weird stuff, there's no evidence-based. Do you guys think there's evidence basis behind what I've just talked about? Yeah. Yes, of course. Physical therapy, exercise, food plan, bone broth, morning smoothies, getting off medications, meditation. I'm going to talk to you about one more case. This is Jim's case. Jim is a very healthy, somewhat healthy person. He's a 7-year-old male who's a runner, and he's got osteopenia. And he fell and he fractured his knee. He sustained a compression fracture of his knee. He was very devastated. He went to see an orthopedic surgeon, and the orthopedic surgeon told him he's going to need a total knee replacement. So he was devastated by that. He came to see me, we talked about it, we put him on our lifestyle plan, which he wasn't that far off. We just improved his diet just a little bit. We increased his intake of zinc foods. We increased his intake of vitamin K. We actually had him do some exercise. He actually kept on running with a brace. This was in the spring, and now he's back to running. His MRI shows significant improvement of bone health, of that fracture. He's running without the brace, no pain, no symptoms. This is Jim. Who knows Jim? I asked Jim if I can use his name, and he said yes. And he then texted me a picture of his breakfast. That's his breakfast, okay? That's Jim's breakfast. He every day has a smoothie. So I like to bring up his case because, we're in a health system that supports wellness. And it's not just us. The support for wellness comes from the top. Jim Nathan, our president of our company, supports this. He supports wellness and lifestyle approach. So I would like to, again, reemphasize, lifestyle is medicine. Diet, exercise, and meditation is medicine. And we need to teach this to our patients, to our colleagues, but we also need to teach it to our kids. Thank you very much.